Hi everyone, I'm Dr. Tony, a radiologist, and today we are delving into a topic that affects millions and millions of men worldwide, and this is prostate health. We'll talk about prostate cancer, we'll talk about BPH and their symptoms, the risk factors, screening, and how modern imaging helps doctors catch problems early, often before symptoms even start. By the end of this video, you understand how to protect your prostate and to live a full active life, even if you are diagnosed with BPH or prostate cancer. So, what is the prostate? The prostate is a small walnut sized gland found just below the bladder in men. It surrounds the urethra, and the urethra is the tube that carries urine out of your body. Its main job is to produce a fluid that nourishes and protects sperms. And as we age, the prostate often enlarges, and this is called benign prostatic hyperplasia. That's what you usually hear as BPH. BPH. It's not cancer, but because it squeezes the urethra, it can cause problems with urination. So sometimes you may have difficulty urinating with BPH. We'll talk about that. Sometimes, however, the cells in the prostate can start changing abnormally, and that can lead to prostate cancer. And this is where we have to be a little bit cautious. The symptoms of BPH and prostate cancer can be quite similar. And here are the most common things you would find with BPH or prostate cancer. So you would realize that your urine might be weak, or you would have a weak urine flow. And this may also come as difficulty starting to urinate. So you go to the urinal, and then before the urine even starts coming out, you are standing there for another 2 minutes before urine comes out. We may also have frequent urination, especially in the night. Here's where you may get up 4-5 times in the night just to go and urinate. And that's a warning sign. We have to see the doctor. You may also have dribbling or leaking after urination, or we may have a feeling like we haven't fully emptied the bladder. So let's talk briefly about what's normal and what's not. So waking up once at night to urinate is usually okay. But if you are getting up 2 or more times regularly, that is called nocturia. Nocte means in the night, and then uria means to urinate. So nocturia, and it's a sign that your prostate or bladder may not be functioning properly. If you are experiencing weak flow or hesitancy, or that feeling that your bladder is never empty, even after urinating, you feel like you've not completely emptied your bladder, don't ignore it. These symptoms may be early signs of BPH or even prostate cancer. Now, what puts somebody at risk? As we age, our prostates may become bigger. So age is a big factor, and the risk rises after the age of 50 years. Also, family history of prostate cancer puts you at a little bit of a higher risk. So if your father or your brother had prostate cancer, your risk roughly doubles. And also our race, Africans and Afro-Caribbean men have a higher risk and often develop more aggressive disease. And then we have to look at our diet and lifestyle. High fat diets obesity, and smoking increases our risk. Also, hormones such as testosterone may play a role, but the balance of hormones as men age also contributes. Okay, so you can't change your age, or you cannot change your genetics, but let's look at what we can lower or what we can change to reduce our risk. So let's look at the food we eat. We have to eat a balanced diet with fruits, vegetables, and low grains. I know that a lot of people um, are not used to eating a balanced diet, especially in Ghana, but we have to make a conscious effort to do this. Okay, limit red and processed meats, and then let's exercise regularly. Exercise in general is good for a lot of conditions, and let's also try to maintain a healthy weight. So try not to put on too much weight, and avoid smoking and excessive alcohol. I didn't say stop taking alcohol, but reduce it as much as possible. And most importantly, get checked regularly. Even if you feel fine, get checked. Screening helps to catch prostate cancer before it causes symptoms. So, for most men, screening should begin at the age of 50, unless you have a family history, or let's say you are of African descent, which increases your risk a little bit more. Then we say that you should start at the age of 40 to 45 years old. Sometimes we say that if you have a family member who had been diagnosed of prostate cancer, maybe let's give me an example of maybe at the age of 45 years, then 10 years before that age, you should also start checking so that we can catch it early in case it so happens that you also develop it. So screening would often involve what we call a PSA blood test, and this is a short form for prostate specific antigen. And this measures a protein made by the prostate, and higher levels um, um, may indicate that there's something happening with the prostate. However, higher levels does not always mean cancer. They just signal that we need to do some further tests. Okay, so if you visit your doctor and you do the PSA and you are getting PSA of 10, 20, don't get too anxious. Let them do the other tests first. We would also do a digital rectal examination. Short form is DRE, and this helps the doctor to feel any hard or irregular areas. So I'm sure you've watched movies where maybe the the patient is on the couch, and then the doctor comes in and wears the glove, and then he's doing this. So that's where they stick a finger through the anus to feel the prostate, to see whether it is enlarged, and they can also feel whether it's lumpy, or whether there are some masses on the prostate. And these are the first steps. So remember, don't wait for the symptoms to begin. Prostate cancer caught early is highly treatable. So let's break down the role of imaging. That is in my area. Okay, so we have ultrasound, which is usually the first step. In fact, I think this November would be um, it's prostate month, and so there are a number of organizations my hospital will be visiting, a number of workplaces my hospital will be visiting, and they will do some examination, and this would include an ultrasound scan to assess the size of the prostate. So the scan is able to look at the approximate size of the prostate, and to tell us whether it's enlarged or is of a normal size. And it also helps us to know if there's residual urine after urinating. So when we do the scan and then we assess the process, we do it with a full bladder, and then we tell you to go and urinate and then come back. We scan you again to see how much urine is left in the bladder. And if there's significant amount of urine, then it tells us that probably you're not able to urinate everything out as quickly as possible. However, ultrasound cannot always distinguish cancer, from benign tissues. It's more of a basic assessment too. Um, we, however, can use ultrasound to guide biopsy also. So, and when we do a biopsy, with the biopsy results from the lab, we can actually tell you that okay, what we took from the prostate is a cancer or not. So let's go to MRI. So we have the multi-parametric um, um, scans that we do, and there's a gold standard for prostate imaging today. Nowadays, that's what we go in for, and it combines three powerful techniques. We call them T1. I won't go into detail, but we call them T1, the DWI, and then the dynamic contrast enhancement. Okay, and using these three techniques, we are able to assess, and then it tells us we are able to grade whatever lesion is there, and it tells us the likelihood of the lesion being a cancer. So we have what we call the PIRATs. Okay, so we have PIRATs 1 being the lowest, then we have PIRATs 5 being the highest. Okay, so depending on which PIRAT you are, then we know that okay, you have a high risk, and then we can advise that they should go ahead and then do a biopsy or not. So then we have the CT and the PET scans, and then once these are done, once the cancer is confirmed, and they are used to stage the disease. So the CT will help us to evaluate nearby lymph nodes and other organs, and then the bone scans. We also do the bone scans, which will detect spread of the cancer to the bone. And we also have what we call the PSMA PET scan, and this prostate specific membrane antigen PET. And this is one of the most advanced that we have, and they can detect even small metastasis throughout the body. So if the prostate cancer has spread to any part of the body, this would be able to tell us that okay, we have this lesion here that is suspicious, and so we would be able to manage it. Now let's talk about the complications of prostate cancer. If prostate cancer isn't treated early, what can happen? It can spread, and often it spreads to the bone, and it causes pain and fractures, or it can move to the lymph nodes and other organs. It can also lead to urinary obstruction, and kidney problems. So once there's obstruction in the urine, there will be backflow of urine into your kidney, and you end up getting issues with your kidney as well. And it can also lead to weight loss. In fact, weight loss is one of the signs that the person probably has a cancer. And we are not just saying weight loss over a long period. We are talking about weight loss within a very short space of time. Okay, and that's why screening and early imaging is so critical. So here's the reassuring part. With modern medicine, most men with BPH or early prostate cancer can live full active lives. In Ghana, we have the habit of not going to the hospital in time, and it's high time that we try to encourage our men to attend the hospital as soon as possible. You don't need to go to the herbalist first before coming to the hospital. Just come to the hospital, ask for a urologist, and then they would guide you through the processes. Okay, so BPH can be managed with simple lifestyle changes or medications to relax the prostate muscles, right? So we have some medications that can loosen the muscles around the urethra and the prostate where the constriction is, and it will help you urinate better. And if needed, we may do some minimally invasive procedures. Some we call it truce, and this can relieve symptoms without any major surgery. And that's the good thing about technology. And for early prostate cancer, we have highly effective options such as surgery, radiation, and sometimes just active surveillance, where we monitor the condition closely without immediate treatment. Okay, so as a diagnosis isn't the end of your normal life, it's the beginning of taking control of your life. Sometimes people are worried about the quality of life when they have prostate cancer or when they are not able to urinate. But your doctor would be able to go through with you, and they should be able to find a good way to help you out. So let's wrap this up with a quick recap. So watch out for urinary symptoms or weak urine streams, dribbling, or frequent night urination more than once in the night or twice in the night. Also know your risk factors. Take the time to find out about family history if you don't know. Okay, and then also know that age is a risk factor. The older you grow, the higher the risk. And then your race also. If you are an African or of black descent, then you are most likely to have a higher risk. And let's also look at our lifestyle, because that's what we can modify in order to reduce our risk. So reduce um, the number of times we smoke and then alcohol. If we can stop it totally, fine, great. Okay, and eat well and stay active, and don't delay your checkup. That's very, very important. With awareness, early detection, and the right care, prostate cancer can be managed and often cured. So if you found this video helpful, please give it a thumbs up. I always say give it a thumbs up, but I really don't get so many thumbs up, and I don't get so many people subscribing. But we want this to get to as many people as possible. So please do subscribe and give it a thumbs up and share with somebody who needs to hear this. And subscribe for more easy to understand health tips. I am Dr. Tony, and remember, your health is your best investment. Don't wait for symptoms to get checked. Have a good day.